This is Cresso, and this is part 57 of the Human Journal. Let go of regrets. Early this year, my mother, she passed on. She had a she had cancer. She had other things going on, and it's been it's been a emotional year, uh, personally for me. But it's been a lot of it's been a lot of definitely struggle spiritually in a large degree. But I uh, I learned a lot about this is like a different lesson in life about how the mind works and how we get attached to things, uh, to people, anyone that we care about. And I just, yeah, there's been definitely it's been a lot going on. And I just, how it went down was that my mother's been, she had like a lot of health issues, and she didn't really talk about it too much, not in great detail. And you know, so I flew in from out of town to visit her, and she was in the hospital, and she wanted to be discharged out of the hospital. She wasn't happy, and so I discharged her. She was going through multiple health issues, not just cancer, but she had other things going on. I do not want to say too much in detail in this audio, um, but when I discharged her out of the hospital and she had cancer, um, she didn't go through any um, chemo, which I was grateful that she didn't go forward with that. She was taking some sort of therapy, which I forgot at the time what it was, but it was an alternative to chemo. No radiation, um, but it shrunk the tumor. She had like a tumor, and so I discharged her from that hospital. Uh, she was basically doing it at nighttime. She was having a hard time breathing. Well, she didn't have much oxygen going through her body. I had to call the ambulance, I think the next morning, and so the ambulance came, and she didn't want to go anywhere, but she looked pretty much, you know, kind of like not all there, meaning there was not enough oxygen going to the brain. And I had to make a quick decision. She didn't want to go back to that hospital, and so I had to ask the EMT worker what's the best. Well, I wanted to take her to this other hospital that she wanted to go. When she told me this maybe a month ago, that she preferred going up there, but it's so far uptown. But when I told the EMT about the hospital, they told me that they're unable to go that far. It's way out of their area. So I had to make a quick decision, and I told them, I said, well, she doesn't want to go to the hospital that she just got discharged. So they went and told me, said, well, they told me, well, I will take her to this hospital. You know, they're pretty good. They came fourth, meaning the fourth best hospital in the country. So that's what I was left with. I had to really meditate, and I had to go with that decision. And I said, okay. So I went with her to the EMT. I went with to their hospital, and when we arrived at the hospital, um, well, to make this short, the the attendant doctor in the ER, I wasn't too thrilled with his um, his whole. He just wasn't optimistic. His vibe was not very encouraging. he told me that my mother, she's very ill. Like his whole attitude basically like wasn't anything to do with solutions or let's just keep, there's still a possibility, we're going to do our best to help her, but it was just this whole attitude. So anyway, I looked at him and I say, well, uh, I mean, are you going to still treat her? Oh yes, we will, but but she's very, very ill. Like, so I had to really take that in. I was starting to feel certain ways about hospitals at the time anyway, and doctors, how doctors are. But I stood by my mother and definitely did a lot of meditation and believe. I remain optimistic, and so we was there for hours. They gave her medication. They gave her some fluids because she wasn't able to breathe well, and then she wasn't able to swallow too much. The I think the tumor at the time was affecting her a lot, but her breathing and far as swallowing was very hard for her to drink. But don't I rather not. Even though this is a journal, I just don't want to share in detail or other health situation. Not into great details. So anyway, we stood there for hours until they gave her a room. They sent her into the respiratory room, and she was alert, but she was nervous. Or she was just she looked like she's very exhausted and going through a lot of pain. They gave her some pain medication. So the day gone by, and I stopped by, visit her. She didn't want me to go anywhere. She wanted me to stay with her, but I told her everything's gonna be okay. I'm gonna come right back. So me being there through the time, looking at her, she seemed to be getting worse, but she seemed to be holding up with the medication that was given her. They changed her medication, meaning they changed her pain medication. They started giving her morphine. Now, um, at the time, I didn't know what the effects would do until her memory um, was starting. She was starting to be confused. This took within a day or two for it to kick in to affect her mind. I spoke to the doctor about the morphine and I find out that morphine does affect memory. And I had to tell them to basically cut her off of that, taking morphine. And one of the things that's been brought up to me, and I forgot to mention the first hospital, when I discharged her, they wanted to take her to hospice. I didn't want to take her to hospice. If I never came to visit her at that hospital, the first hospital, now I'm saying, they would have taken her to hospice. Even though they have to get her consent, she was well enough in terms of making a judgment to make a decision. But this second hospital, the hospital that I took her, they wanted to take her to hospice. And I told them no. I said she needs to be treated. She needs to be treated well and needs to be discharged to continue on with her treatment, with her cancer treatment. So, but they kept persistently wanting me to take her to hospice. And I learned that hospice is the last resort, that the so-called 7 years of doctors that got trained, this is their last resort of saying, we give up, we can't do anything for them or the patient. And I stood very firm in making sure this hospital was able to take care of her. One of the things I've been noticing is the diet, her diet, what they was feeding her. which was very questionable. She was in a respiratory floor. The dietitian had the nurse feed her chocolate pudding, yogurt, dairy stuff, even though she wasn't able to chew, but they was giving her stuff that would basically produce more phlegm. And it took me a day to realize, like, why are they feeding her this? And I had to consult with the dietitian, and I had to talk to someone about this. And I mentioned about why don't they give her cold pressed juice or something, some fresh, something soft, some fresh, maybe applesauce or something. The dietitian never heard of cold pressed juice, which I was amazed, but at the same time, not surprised though. Um, so I was um, I was going through a lot of emotion about this, about me taking her to this hospital. I felt it was a mistake that I took her to this hospital. The treatment was the way they was treating her, the decision making as far as her diet, it was getting worse. Meaning she was getting worse. Her breathing was getting worse. So the stuff that was feeding her, it played a role into her health. More phlegm was building up. So they cut down, or they stopped giving her yogurt and chocolate pudding. But it didn't solve anything clearing her throat. They was giving her fluids, constantly giving her fluids. Um, my mother, she was basically was looking at me. I could tell the morphine already affected her already, even though they stopped giving her that. Um, they was telling her that they warned me about, they stop it, her pain's gonna get worse. I said, well, the morphine is not helping. She looked like she has no idea what's going on. She doesn't know where she's at. So the morphine already took damage. They told me that it's going to take a while for it to wean off her system. So, um, but she remembers me. Um, she didn't know where my stepfather was located. He's in another facility he have his own health issues. I had to tell her that he's over there. He is doing fine. And she's telling me where she is. I told her she's at this hospital. And she wanted to leave. I told her, look, you can't leave. You got to get well here before we get able to discharge you. She was she was very difficult at first because she wasn't happy, and I understand. And this one doctor, they rotated doctors, and this doctor, my mother, out of all the people, at least the nurse staff was very nice. And but when they rotated the doctor, that's or the I don't know how you call it, the they when they rotated the physician, this particular doctor, my mother wasn't very happy because well, he's very smart, this physician, but he's very cold. His personality is kind of like Spock, very cold, very disconnected. He's very smart, but somehow, obviously, my mother didn't like him. When I talked to him, I didn't like his personality at all. When I went in the room with him to see my mother looked at him like she looked at me like she wanted him out of that room. She didn't want him there. So this particular physician with this cold personality and the nurse administrator spoke to me again that she's not getting better. I said, okay. They was telling me, well, we they suggested to me about her going to hospice, and I said to them, look, between the last hospital and some people in this hospital and downstairs in the emergency room area, I told them, no, she's not going to hospice. And so this physician was telling me, well, okay, he was telling me, if anything, if your mother's not able to breathe or something emergency, they wanted my consent because I was I guess I was the health proxy. I forgot what they call that, but it was a health proxy. They told me that do you want us to perform CPR on her? They told me that if they do that, the risk of them breaking her chest will be very high. I said, no, don't use CPR. Have I chose the machine, meaning that the machine is going to help her breathe. And I felt like I made the right decision at that time. That very same day, that night after I spoke with the physician and the nurse administrator, um, I went back in the room, spent a little time with my mother, and she held my hands, and she was telling me, she looked at me, and she keep asking me questions like where she's at, and I had to remind her where she's at. And again, the morphine took toll into her memory at the time. It was getting late. I wanted to head back to get some rest. Um, I just wanted to step, to come back the next morning. When I told her to look, I told her that I'm gonna come back in the morning. She cried to me and told me, please don't leave me. And I held her hand and I told her, I said to her, no, don't worry. Everything's okay. You're okay. Don't worry. I'm here. I'm going to be back in the morning. Well, I went I went back. I went back to her place to get some rest and just to get my mind off. Meaning, I just had to unwind. Meaning, it was very hard emotionally. I had to regroup. It was just very difficult. But I just believe firmly that my mother, she's okay. Well, I went to sleep, and I when I woke up the next morning, there was a call that was around 3 o'clock in the morning. The physician for the overnight shift called me and told me that they had to send my mother to the ICU unit. Um, they made it very brief in my voicemail that um, there was a lot of blood coming out of her nose, and they had to send her to the ICU unit. They had to perform um, procedure to send her to the ICU unit. They had the machine to breathe for her. And what's interesting about this, even though I was very upset and emotional when I got this message, I didn't hear my phone ring. The first thing came to my mind when I heard this voice message is that this doctor, the physician with a cold personality, his conversation with me was that he was banking on, in my own words I'm saying this, that my mother is not going to do well and this is going to happen that very same day. And that's why he was asking me, well, is she, do you want us to do CPR or have her get connected to this machine if she's not able to breathe? It's just that the timing is very interesting because as if he knew something's going to happen. I was very angry because I needed to find out about this doctor. I felt purposely that this doctor wanted to send her to the ICU unit because I told them that I do not want her to be in hospice. Hospice is the last place that anybody should be because they're not going to treat you. There's no solution. It's basically, well, I could just say this. It's like slow death. Now, even though I always say that there is no death, it's just the experience. It's the feeling of not taking care of yourself, not treating yourself what you deserve to maintain your body in a good way. And that's why I stood firm about her not being in hospice. But it was very questionable that she was sent to the ICU unit. And I know I felt like I was building some sort of conspiracy with this doctor, but I just felt that my gut was telling me that they purposely sent her there. Also, they needed a room. They needed a room to be vacant for the next patient for the hospitals to make money. Anyway, I went to the ICU unit. Obviously, she had a tube in her mouth. She can't talk, and I felt bad. I felt like I should have never left her. I should have kept an eye on her. But I see what the mind was doing. She was getting worse. They couldn't do anything for her. And her we have relatives came over and visit, and I learned from family, from other relatives that they used to work in the hospital, and I told them what happened, and they would pretty much explain to me what I just said a few minutes ago, that how the hospitals operate. It's all about business. It's especially how the rooms are, especially about the whole room arrangements, far as transferring one patient out, getting one patient into another room. Just the whole breakdown about how the hospital operates. I wasn't surprised, and so I stood there, and there was other things that was going on that I wasn't very happy how the hospital cared for her. And I was meditating. I was asking consciousness, my higher self, to pass this energy through me. And I was meditating from other spirits within consciousness to meditate, to pass this energy to her. I was doing my best to create a connection, and I didn't give up. Seeing her with a tube in her mouth, she could barely talk. She just didn't know where she was, or I could just, her face expression wasn't like, it was like no awareness into some degree. She was getting worse. And when I wasn't there, um, they called me, and I just left the hospital, and they called me and told me that she passed on. And I was very emotional. I was tested even before she passed on. I wanted them to continue. I wanted them to do something different. I had to be on top of these people a lot. I learned right away that the way these hospitals work, if you don't have anybody that's a family or friend, these people in these professions, they're gonna make decisions for you. And obviously it's not always the best decision. But I realized right away that this is the paradigm when it comes to the medical field. Yes, HMO plays a big role into this. They will tell you what you should need, what you need, and how long you'll be able to stay in the hospital, or how different medicines are administered. Everything is a business. And I came back to the room and I saw she, I went to the ICU unit, and the nurse that was there, they left for privacy for me and my mother had passed on. And I'd look at her body, and I was doing something was clicking within me to do this. I felt that I was reconnecting to something or some techniques that I did know at a different time. So what I did was I placed my hand in her third eye where the pineal gland is at, right in the middle of her forehead. And because I wasn't there when she left her body, I wanted to see what she experienced at the time that she departed her body. So I placed my hand in her forehead and I just meditate. I closed my eyes, I meditated. And she felt pain, lost, very similar to what people feel when they have their life after life experience. But obviously this is a little bit different because you're actually leaving your body permanently. She felt confused, and but then she was escorted into this tunnel, and I saw it, and I closed my eyes. I was meditating, and I told her in spirit, "I'm sorry that I left the room, but at least I know in my heart that she's in a different place of happiness." And I understand what this is like. I understand about life after life. I understand about this. I was going through conflicted emotions, meaning of attachments, and it was a huge test, and my mind was tempting me with so much regrets that I should have never taken her to that hospital. So the thing is, I wanted to say in this journal that let go of regrets. It's only gonna keep you in a very limited space. Let go of regrets. Everything happens for a reason. Your ego will not understand this, and I already know that. I had to be patient with myself because one side of me, which is the human part of me, feels that I feel lost. I feel angry. The other part of me understands that life is infinite and that there is really no end, and that this is really a celebration because she's happy and she's moving on. She moved on. She is still alive. She's not in her human form in this dimensional time space, but she is alive. I knew that whether she's going to continue to remain as a spirit or she'll reincarnate it into a different form. And I know that truth. But the human side of me wasn't connected to that truth. It was filled with regrets and anger. This experience that I got from this was, well, one of the things, honestly, truthfully, I felt in my heart that I wanted to attack these doctors. That's how I felt. I said to myself, these doctors are absolutely useless. They are following procedures or protocols that are very limited and is regulated by the government. I understand that everything in relation to the hospital, for example, is all about business. These are the things I was going through within myself. Everything for the hospitals, everything is a business. This is a very limited paradigm that so many people have to go through. I wanted to sue the hospital and the doctors, but I didn't have enough in me to do it. But this motivated me because if I said to myself, if I sue and get a large settlement, I didn't want to get the money for my own personal gain. I wanted to use that money. I wanted to build a healing center, an alternative to hospitals. I wanted to build an alternative to hospitals that is actually filled with natural substance. My own head is telling me that's not going to happen. How are you going to do that? You have to go through politicians and lawmakers. And I said to myself, fuck lawmakers, this idea of lawmakers, and fuck politicians. I envision a healing center. I envision a place that people would go there and treat themselves with natural substance. No chemical drugs, just natural substance. People educating themselves. I felt, and that's how I felt. I see that this inspired me to go about building healing centers. And that's where the money was going to go towards. I haven't pursued any lawsuits. If it's not through the lawsuits, it would be other means. I know infinite or consciousness will provide. I don't know how, but I believe my higher self will provide. I want to build a healing center. Just build it. I'm not asking permission. I'm just going to build it. And that's what I envision. I envision myself built, that I built, not just me, but along with other people. We just built a healing center that has vitamins, natural substance. People are able to maintain their body in a very good way. I do know that there is no death. According to our ego, there is a death because it's a death of identity that what you see yourself as now. But your spirit doesn't die. So I understand fully about the idea of death and why people don't like death. Well, a good number of people. I learned a lot about myself. I learned a lot about looking back on my relation with my mother. Our relationship was up and down. And it was it was definitely just looking back, I learned a lot from this experience. Every now and then my mind will come up and try to suggest me to feel guilty, and that is why it's important to let go of regrets. Let go. Embrace infinite life. Let go of attachments. Let go. And I just want to say that everything happens for a reason. There is no accidents. Your spirit, my spirit, will continue to live. And this is the truth that many people, many people must understand and connect to that truth. And I'm glad I doing this journal to reflect, to go back and to think about my experience, my time with my mother, and how these things happen, and how these things inspired me to do this journal. I honestly don't care if anybody that's listening to this audio that's a doctor and that takes it whatever personal. I don't care. All I know is that the paradigm is designed for limitations. The paradigm of doctors, for example, are only going by textbooks, what they've been taught in medical school. I understand that the paradigm is designed not to heal you, because if you're healed, you're not going to go back to the doctor. And then how the doctor is going to make its money. I understand how the HMO works. I understand how the pharmaceutical drugs work. They only give you temporary band-aid. If you're able to take care of yourself, or let's say you let's say you are self-efficient, you're able to take care of yourself in a certain way. Yes, you take natural substance. Yes, you educate yourself. The pharmaceutical companies are not going to make no money. And the doctors are not going to make no money. The dentist is not going to make no money. And that's what really matters the most, is the paradigm is designed to make money. Our higher self created these things for a reason. Our higher self allowed these limited belief systems to happen for us to really examine these things and look at these things as a learning experience. And then you say to yourself, you know what? When you gain that truth, let's say, when you reconnect to that truth about infinity, what infinite is, you will definitely drop these limited belief systems, and you will go at your life at your highest joy. You will maintain your body in a certain way. And even though you maintain your body in a certain way, yes, your spirit is going to shift into a different dimensional time-space. But while you in this human experience, you're going to maintain your body in a certain way, something that's good. You're treating yourself. People deserve to live in good health. I don't care who you are. So I do know that this experience inspired me about a healing center. I don't care about shifting out these doctors and these dentists and these pharmaceutical companies out of my reality. It doesn't bother me whatsoever. So I do know that anybody listening to this audio will be inspired and recognize the truth of how these paradigms operate. It has really nothing to do about me and you living in good health. The truth is the truth. This is not any opinions. I give 2 cents about opinions. This is the truth. And I'm glad I did this journal. And definitely looking forward for part 58. Take care.